treatment at Skin by Lovely, and I'm just a little bit nervous. I want you guys to come on this journey with me, and to do that, we need to go back in time about 2 weeks ago. So let's initiate the dream sequence.
Hi, my name's Brienne, and I'm 34 years old, not 43. Do I look 43? Because sometimes I feel like I do, and that's exactly why I'm here today. I kind of looked in the mirror one day and thought, gosh, Brienne, you're starting to look a little older. I don't know if it was my son, love him to death, but he's 2 years old, and I've had a lot of sleepless nights, and I think that might have taken its toll on my skin. So I think that my skin has started to age, maybe like 5 years overnight, and I don't like it. It's not cool, and I really want to try to do something about it, which is how I found Skin by Lovely. I want to make sure that this face is in the best hands possible. So I did a ton of research, and I found out that Skin by Lovely has an amazing reputation in LA, and that's followed through with their office here in Portland. But what I really, really loved about them was that they seem to specialize in the art of subtlety, subtle aesthetics. And I don't want to look like I have a frozen face. I want to look like me at the end of this, just a better version of me. So, you know, I'm hoping that maybe, you know, my collagen loss here and, you know, maybe a little pick me up here and here will take a few years off and get me starting to feel a little bit better about myself. So today is the day. I'm super excited. So I want you guys to come with me on my first trip to Skin by Lovely. Let's go. Hi.
Hi.
My name's Bria. I have a 10 o'clock consult today.
Great, I'll get you checked in. How are you doing today?
I'm good. I'm a little nervous, but I'm excited too.
Don't be nervous, you're in great hands. Okay. Welcome to Skin by Lovely. So Bria, I'm just going to take a few before photos, and these are totally confidential. They're just for our records. They're just to compare to your afters.
All right, guys, it's almost time. They've asked me to come in here and wash my face. So I'm going to go do that, and then she should be in a second. Don't be frightened. All done.
Hi, Bree. How are you?
I'm good. How are you?
My name's Lovely. It's nice to meet
to
you.
meet you
Welcome.
too. Thank you.
How's your morning going?
Good.
Great.
Yeah, good. Busy.
Yes.
Excited and nervous.
Everyone says that.
Yeah.
So, first time I meet people is just hand you a mirror, and you kind of tell me the things that really stand out to you first. And I saw some of the things that you checked.
Right.
But let's kind of start from the top down.
Okay, so yeah, this is good because I don't know if I have, was it like body dysmorphia? This is where I notice that I look slightly older is kind of lines around here.
Okay.
And I feel like I'm, like this chin area down here is kind of a bit hollower. Okay. It's not as full. And then my lip area, when I go like that, I get those lines.
Fine lines.
Yeah. And then, you know, just the forehead area and eyes when I smile. I don't think the lines aren't deep there, but I'm starting to notice them more.
Yeah.
So, yeah.
It's nice too. I think a lot of the time, what we're hearing more is that people are focusing on more preventative, and that's the best way to actually start in aesthetics is more preventative, because what happens is if you wait later on down the road, it's going to be a lot more expensive.
Right.
And the goal is really to train your muscles to perform a certain way to prevent lines from forming.
Okay.
And then the other thing too, people tend to think they're too young for dermal fillers, when really all fillers do is give us the support that we need, that underlying structure in your face to prevent sag.
Okay.
So you're kind of saying...
That's what I'm seeing. I feel like it's just kind of going, it's going south a little bit. At some point I've just noticed, I think it can only take you so far, maybe skincare can, and you need to look at something like this. But just that's why I liked you guys, because I read that you guys just do subtle things. I want to look like me. I still look like me. I don't want to like frighten my husband or, you know. And I've heard really good things about you guys. So. And
that's the number one goal. It's not to make you look like anyone else. And I always say it's more restorative aesthetics, which is just restoring what you naturally have and kind of tacking it back into place versus creating something that was never there. Because I think when you focus on creating something that was never there or enhancing things too much, then it starts to look unnatural.
Right.
So the earlier you start, the less intervention that is necessary. And I can kind of see what you're talking about. There's been a little bit of a shift.
Yeah.
And I read in your paperwork that you have a little one.
Yes.
Yes.
Yeah, I think he did this.
Yeah. Sometimes hormonal changes, weight changes, all
Right.
of those things then we really start to notice kind of the downward slope going on with our face. And you're still young.
Yeah.
And so it's a really easy, quick kind of fix.
Okay.
So suggestions, would you like to hear my
Yes,
suggestions?
yes,
Okay. So furrow your brow really hard for me. Perfect. Okay. So I'm going to be conservative because we know we can always add more.
Right.
You can't take away.
Yeah.
And raise your eyebrows. Okay. And then big smile for me. Beautiful, beautiful smile. You have beautiful eyes. So the neat thing about this treatment is that it's really going to kind of showcase your eyes.
Okay.
And sometimes people feel like their eyes kind of disappear. They used to get a lot of compliments on how bright and beautiful their eyes are.
Right.
And they kind of sink into the face. So
Yeah.
we want to open your face a little bit, okay? And then what I'm starting to see is a little bit of descent of your cheeks. So they're starting to come down a little bit. And I can tell because when you smile, big smile, this area, if you look in the mirror, I'll show you, this area flattens and this one is projected out. So all we're gonna do is focus on adding just a little bit of a foundational product, such as Voluma,
Okay.
to pull back that area and lift. And that's subsequently gonna lift the lower face.
Okay.
I always like to say the cheeks are like the walls of a house. They keep everything up.
Right.
So when we lose the cheeks, everything shifts down.
Okay.
So I like to use Voluma on you. Voluma lasts 2 years.
Okay.
It's a hyaluronic acid filler. So hyaluronic acid is something that we have naturally in our skin. It's what holds water in our skin. The neat thing about Voluma is just the way that it's made.
Right.
It's harder for the body to break down, but it's still a natural product. And it adds a lot of lift.
Okay.
And that's what we want is lift.
I like the sound of lift.
Yes, yes, exactly. So I'll
Okay.
focus a little on the cheeks to give you that lift. And then we'll just do a light little dusting of a Botox in the upper portion of the face
Okay.
to help smooth out the fine lines.
Okay.
Okay? Sometimes just by lifting the cheeks, this area isn't as prominent anymore.
Okay.
If when you come back for a follow-up, we still notice it, we can always add a little bit of volume there.
Okay.
Yeah, we'll see.
Okay.
Okay?
Sounds good.
Botox will take about a week to 10 days to kick in. So we see you back for your follow-up.
Right.
The filler's pretty immediate, but you will swell and there's always a chance of bruising.
Okay.
Okay? Bruises take anywhere from, a couple days to a week to heal.
It doesn't hurt at all.
Good, and one more furrow for me. Relax. Big breath in and out. Time for me to relax. Good.
No, I think I built it up in my head to be like a lot more of a bigger deal than it actually is, because it doesn't, like, it's just a few little pinpricks, and some of the areas, for the most part, it's pretty painless for me anyway.
The face definitely has more nerve endings, so you're gonna feel things a little bit more, especially in areas like around the eyes and above the lip. But in general, it's pretty easy. It's not, I always say I've never had a patient not come back because of pain.
Right.
It's always worth it.
Yeah.
And then this cheek is quite a bit smaller than this one, and that's pretty
Oh.
typical with patients.
Because we sleep on it? Okay.
Yeah. So I'm gonna do a little bit more on this side. I'm gonna start with this side. Big breath in, let it out, little sharpness. Voluma to kind of incorporate into your skin. So sometimes right after we're done, it can look a little sharp on people.
Right.
And then it just takes a little while to soften up.
Okay.
So that's what, everything takes time. Big breath in, let it out. Beautiful, yeah, and then take a peek at me. Very pretty, good, we're almost done.
Okay. Will last a couple years.
This lasts 2 years, yeah. Making sure everything looks really pretty and symmetric, and it does. And I also like to make sure everything feels smooth. Now we did a little Dysport in your upper lip. When that kicks in, it's gonna feel a little stiff for about a week.
Yep.
So when you brush your teeth and try and spit, it'll feel a little funny.
Okay.
But then that softens, okay?
Will like when I'm washing my face, will my skin feel bumpy at all?
It shouldn't unless you bruise. And sometimes bruises feel a little hard under the skin.
Okay.
And that will go away.
All right. Okay. Wow.
Beautiful.
Yeah. Oh, I can't wait to see my after pictures too. Yeah, I can really tell.
You can see everything shifted up, right?
Yeah.
You don't quite feel that
It doesn't
heaviness.
look droopy down here anymore.
Yeah.
Wow. That's amazing.
Beautiful.
Yeah. That is amazing.
Hi Bree, how'd it go?
Really good.
Good. I have some skincare to talk to you about. What are you currently using?
I used to use great stuff pre-baby, and now, yeah, I'm not doing a mask. It's like just kind of basic cleanser and moisturizer, and
We have our own skincare line. It's all natural. There's no parabens or sulfates in anything, and it's mostly organic. And a lot of the products we have alpha hydroxy acids in them, so they're going to be really active to help your cells turn over, which is going to stimulate collagen and elastin, help with pigmentation, keep your skin hydrated. So this is a post-injection kit that you're going to take home today. This is going to have everything that you need to help preserve your fillers and your injections. So it's got a cleanser, the serum, your vitamin C, hyaluronic, and arnica. So this is great to have on hand for any time. We recommend the active silk therapy. So this has a lot of glycolic and lactic in it. It can make you sun sensitive, so it's a really good night cream that you can use. And then vitamin C is something that I recommend, especially if you're concerned about pigmentation, because that's going to help. So that can help reverse and prevent sun damage. It also blocks free radicals throughout the day, so everybody should use a vitamin C. So if you're not using that, I would definitely recommend getting that today. Hyaluronic acid is going to really help post-injection as well. It's
plumps the skin, right?
It plumps the skin and it binds moisture. This you can apply after your treatment to help with swelling and bruising. So you can do that as many times of the day that you feel like you need to have that done. I do have some post-treatment care instructions for you as well. So you can refer to those if you have any questions, but you can always call us or email us after hours and on the weekend. And I also have a gift bag for you that has some additional products in here. Well, thank you so much for coming in. It was really nice to meet you. And just give us a call if you need anything.
Let's go take your after photos.
Okay.
And a big smile. Beautiful.
Bree, I'm Tita. I'm Senior Injection Specialist here, and I met you a couple of weeks ago. It's good to see you again. Yeah. Well, you look great. Everything looks as I expected it should, but go ahead and tell me how you like the results.
I'm really happy. It's taken me, it's really good. It's taken me a little while to get used to it a little bit. I love the filler. I love it's so much fuller there, and I notice that I'm raised a little bit down here now.
There is a little transition period when your muscles are learning new patterns, and that becomes very familiar. And just let me know if not, but it should just feel really natural very soon. Your cheeks look great. I think you can expect a nice 2-year result here with the products that we used. Your Botox will last 3 to 4 months.
I feel like I look a lot more rested. So.
You look great. You really do. So Bree, lastly, and very importantly, I'd like for you to follow up with Lisa today on the way out, where you can sort of revisit the skincare recommendations that she made so that you can really get the most out of our treatment and just keep your skin looking really healthy and beautiful. And in the meantime, just really enjoy your look. You look absolutely beautiful. Call us back if there's ever any issues that come up. We'll get you in right away. But other than that, we'll see you back in about 3 months.
Okay, thank you so much.
You're
Tina.
welcome. It was a pleasure.
Thanks so much.
Yeah.
Hey Bree, how are you?
Hi, good Lisa, how are you doing? Good, it's good to see you again. Yeah,
You look great. Yeah. How you doing? Are you happy with everything?
Yeah, I
happy
am.
with the skincare? Awesome.
Yeah, filler's been awesome. I definitely feel like I have had kind of a lift with that, and taken me a little while to get used to the Botox, but I'm sure that will come.
Yeah, definitely. So we'll just see you back in probably 3 to 4 weeks. Yeah. Or 3 to 4 months, I'm sorry, for your next Botox treatment.
Okay. So I'm back home for my follow-up. Everything went amazing. I ended up meeting with Tita, who's a senior injection specialist. and she said that Lovely did an amazing job on me, which I agreed. I think everything looks great. So I hope I have helped anyone who maybe was a little bit nervous about having injections for the first time feel at ease. I was, myself the same way, and I had an amazing experience here, and I think everyone will too. So I'll be back in 3 months' time, and I apologize you can't join me for that visit because you're not invited. You were just invited to this one.